welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Dr. Sima Yakoby Epstein, orthodontist and founder of OrthoNu. She's built one of the most forward-thinking oral wellness companies in dentistry, bringing clinical insight and smart technology together to help patients and providers catch issues earlier and improve outcomes. So today, we're talking about innovation, prevention, and the mission behind her work. Let's get into it. Thanks for coming on, Dr. Yakoby Epstein.
Thank you so much for having me. I'm very excited, Nick.
So let's rewind all the way back. What pulled you into the field of dentistry and then, from there, kind of the broader oral wellness space?
Yeah, so as a young child, as you know, I was kind of an immigrant home with a lot of the family members around me being doctors in Georgia, coming over to the United States, living the American dream. So I was surrounded by a lot of medicine and dentistry. And then when I was in a car accident at 13, that kind of changed my trajectory to sort of live in the dentist office for all those formative years and even still into the adulthood. And that's kind of the impetus of how I wanted to understand better how I could help people, knowing what I had gone through and how painful it was for not only myself, but for my family. And it really led me to be so passionate about, dentistry and then orthodontics and understanding how as a clinician, I had so much power to help somebody when they were at their most vulnerable moments. And that's really what still drives me today is the idea that you can help one person and you can instill a little bit of hope in them to change directions, and that will make all the difference in the world.
I love that. And now you're full-blown entrepreneur, right? Stepped aside from being a clinician. What was that moment? Like, when did you realize, hey, I'm starting a oral wellness company and stepping aside from practicing?
I think it was a natural progression of being a clinician for over 10 years, having sort of children, raising them, COVID hitting all kind of in parallel. And at that moment, understanding that I had so much more that I wanted to give. And even though through clinical practice, I was able to give that to my patients firsthand, I felt that there was such a gap in the industry that nobody was really figuring out ways to help patients after they left our offices. And I thought that was something that I was really good at. And I said, okay, I know everything that happens to me as a patient growing up, all the things that I experienced going home and not having the ability or the power to know how to make those changes successful. And now as a clinician point of view, I felt that I have all of this opportunity being in research and science and being able to kind of put the pieces of the puzzle together. And so that's kind of the moment where I knew I wanted to go and really focus on this company. And it wasn't something like, oh, I'm going to, go build a company. It wasn't like that. It was like, I'm going to create this product. And then it was like, well, if I'm going to create this product, then this kind of makes the other products seem more applicable. And then when I started with one, I sat down for 2 days and I came up with 18 products.
Yeah.
And I thought all of those were so incredible. And then over the course of the last 4 or 5 years, what has happened is actually mind-blowing in terms of what you create and what you feel is so important and how that kind of brings in so many other powerful things that you could incorporate into different verticals and, intertwine kind of all these verticals strategically to make it work for the ultimate, person that we're trying to treat, which is all of us, the patient.
Yeah. Yeah. So patient care comes first and foremost. How would you, I guess, for listeners unfamiliar with OrthoNu, like what's the elevator pitch? Like, can you describe it in your own words?
Yeah. So OrthoNu is an oral systemic wellness platform, really focusing on precision dentistry and medicine. It has 3 pillars, one which is the oral relief collection or the oral relief science, which was the impetus of knowing the orthodontic emergency sequelae that every single one of moms and dads have been through with the patient and braces or aligners, and really approaching it as a new category of products that patients deserve to have before they leave the office, having all the products that they need that they're equipped with when those emergencies happen at the most inopportune, stressful moments. So that vertical is obviously commercialized and we're selling globally, and it's really gaining momentum in all dental service organizations and dental practices all over the world. The second vertical, which is the new smart diagnostics, which really focuses on detection oral diagnostics, prevention, and healing is really something that's very novel and innovative that we're bringing in Q1 of 2026. And that's kind of a take on let's dive deeper into oral health and how we as clinicians are kind of oral physicians in the fact that we can diagnose, we can have awareness in patients' mouths way before anything comes up in blood work 10 years later. Something as simple as having a strip in a clinician's office that is able to detect oral cancer very easily, seamlessly into clinical workflow as an awareness. Obviously, other things that we are able to create in terms of diagnosing systemic health and halitosis, anywhere from very simple to very extensive things. This is the technology that I think this pillar will bring to the table, making things more simplified so that we do not have to deal with crisis moments 10 years down the road. Because I think that's where medicine is really about treating the crisis and not preventing. And I feel like as clinicians, oral physicians, I say that is our job to communicate with doctors and to patients, where their oral health is real time at an early age all throughout.
Yeah. And what was the first, I guess out of those, like what was the first problem you solved? What was the first product?
So the first product I did was in the oral relief collection, which was the Tweakz for braces, which was the hero product. And that was really like anytime, sorry, just one thing I wanted to add. The third vertical is the wound care and the regeneration. And that pillar is on its own right, really for new innovation in utilizing strips that have biofactors, peptides, collagens, amnion incorporated in that type of system that's never been done before in the chronic wound care space. So to go back to the first vertical, which is the oral relief science, the first product that we did was to create a product that would essentially eliminate all of the bracket and wire and aligner emergencies.
Yeah.
Typically, as many orthodontists still do to this day, when there is an emergency call on the weekend, many times if the wire is poking into a patient's cheek or irritating them, they would say, go find a toenail clipper or a plier in the garage. Now, none of those stories ever end well, but it was sort of the standard of care. So I have had way too many of those, and that's why I created Tweakz for braces and aligners, because it is the proper tool that's the most safe and effective to cut and hold the wire. That was the first sort of hero product. And then it came to, well, while they're in braces and aligners or any post-dental procedure, you suffer from canker sores or, ulcers. So that's where mouth aid was born. Or people just suffer from very sensitive teeth and swollen gums, gingivitis, periodontitis. And that's where comfort tape kind of played a big role in care. And then there was the Chillin Strips, which was the replacing wax, but it became really the impetus for all the other verticals in the sense that it was the first ever universal dissolvable strip that was able to essentially stay where you put it, where the adhesion would activate with saliva. So the idea was kind of counterintuitive because people were used to wax. And when you put wax in your mouth, it falls off within 30 seconds. And this kind of changed the game where you put it, it stayed and it dissolved over 2 hours while you could eat, drink, and sleep with it, which is really solving so many pain points for patients. And the last one was the OrthoChoose, because I knew how much it was so difficult for patients that were in aligners. They wanted to chew on something. They had oral fixations. And really the only thing that they got in their goodie bag was the silicone chew,
Yeah.
which they would use, and it would harbor bacteria. And it was just such a high durometer that after 10 seconds of chewing on it, their muscles of mastication are firing. And it's really something I wanted to do for my patients, to have something that was dissolvable, that they can chew on therapeutically, that would bring blood flow to the tissues, that would help with dry mouth and bad breath, and really be something they could use all the time throughout treatment that changed their experience. And that's kind of the oral relief collection that was born.
Yeah. And I mean it's disrupting the industry, right? People had no idea. What do you think took so long for somebody like you to come along and come up with these solutions?
I think a lot of people, like big industries and big companies, they really focus on, the technology and what to bring in for the doctor and what gadgets the doctors need, and how big can we expand upon in the industry from the clinician side. And I think the patient kind of gets the short end of the stick because no one really kind of walks through when the patient leaves your office, like what is really going on with them. And there's so many self-reported issues from post-ortho treatment or even a post-scaling and root planing. You'd be surprised. People have sensitivity, they have pain, they have ulcers, they can't eat, they can't drink. These are real lifetime, realistic things that are happening to the patient. But again, I think bigger companies are so focused on the big picture and the technology and the AI that they forget the simplicity of no matter how much you want to be successful and scale and be efficient, if you cannot help the patient when they're at home and prevent a lot of their emergency sequelae, this whole system doesn't work. It's all about the patient. It's all about how they are and how their experience is. At the end of the day, I think that's the most important thing.
Yeah. Well, I mean, providing, therapeutic tools that didn't exist before for continuing patient care is, I mean, essential. And what led to the other verticals of the business?
Yeah. So I think for me, once I started to delve in, like, what is this epidemic of cavities and periodontitis and gingivitis, and where is this all starting, and why is this happening? And I really did a lot of research and read a lot of articles. 2 o'clock in the morning, when people are watching TV, I'm reading articles. And what I found was that there was a lot of amazing ingredients that had been clinically studied that are very therapeutic at certain levels. And if I integrate them together, I could potentially create through my vehicles something that would help the epidemic, something that we could identify if a patient, like a child, is suffering from multiple cavities. They say, oh, my child eats candy, oh, my child eats fruit. No, not necessarily. Why is it that some people don't get any cavities and they drink soda all day, and some others are brushing their teeth 4 times a day and they do? And the truth is that it's really about your microbiome and your saliva and the pH of your saliva. And if you have predisposition to acidic saliva, then you're more prone to get cavities. And so what I found is that I could utilize my technology to put the right therapeutics and ingredients in it to change the microbiome flora, to make it more alkaline, and to be a protocol for patients to use to be able to prevent those disease states. That's as simple as the cavity. It's as simple as the gingivitis and the inflammation that people have. So that is kind of how that went to the next level. And also for me, I wanted to understand what are the best ingredients in toothpaste and gels and microbiome gels. And I did so much research and worked with so many different companies. Like, I've really fortified some of the best products that I want to use, that I want my children to use, that I want my friends to use. And so that's kind of how the oral microbiome collection came to be. And then the sort of prevention and the healing is really, again, the same sort of technology being able to be utilized in pharma, in wound care, really creating another category that is very much needed. For example, people that go through surgery, they have to take off that steri strip. They can't eat, or they get an implant, or they have an extraction. Those things are not solved for after patients leave. They're just kind of dealing with it, or they're getting a dry socket, or they're having to reignite the wound, or they have to go back to the doctor because they got infected again. And so the idea of having a technology that helps to facilitate that 72 hours of wound care that's very critical for healing by utilizing a strip that can basically solve for those 72 hours is mind-blowing to me, because no one has ever really created something that can be utilized for a patient after they leave the office. And that's kind of where the second line came about. And obviously putting the patient first and having the app integration and the software where the doctor, the dentist, and the patient all understand what's going on. Kind of like, glucose monitoring system or the Aura rings or anything like that. There's so many diagnostic platforms that are helping you with your health, but there's nothing that's helping you with your oral health. And that's where OrthoNu is really trying to, what OrthoNu is creating.
And do you think that, OrthoNew's industry disrupting solutions are changing patient expectations then?
Well, I think that's naturally happening with patients. I think patients are a lot smarter. They understand sort of, something is different in terms of what they're being told versus what they're investigating on their own. And I think the more they're, aware of, what they look like and what their smile looks like, the more they kind of read or hear about, what is important for their oral health. Or, now you have all these longevity pipelines of opportunity. so many books coming out, Peter Attia talking about what's important. And I think people are more aware of like, why would I do or treat myself the way my grandparents did when they basically died very young and didn't exercise and didn't eat well or didn't take care of their mouth. Right now, they're like, we don't want to live that way. We want to live longer. We want to have a better, full life. And so I think that the consumer population is quite ready for what's coming. I really do. I think, I've spoken to Colgate and J&J, and they said they were always waiting for when to introduce microbiome. Like, we're patients ready to understand what that is. And I think that we're here.
Yeah. I mean, do you think that chairside biomarker technology will become standardized? And how widespread are we, and like where is it headed?
Yeah, so even now there's a very simple lateral flow diagnostics that are sort of, being incorporated into many practices. There's even an insurance code that PDS Health actually was able to get so that people are, early on take a swab when they go to their visit and they're able to see what's going on, if their, biomarkers are predisposed to cavities or certain biomarkers or certain disease states. And that, I think, is happening. It's happening now, and it's a matter of time where all dental service organizations or insurance companies make that the standard of care. But at least it kind of level sets like where you are, right? It's just knowledge and information that you otherwise wouldn't have. And the idea that the clinician and the patient kind of have that together, I think, is really special, right? Because, I mean, you always want to talk to your doctor and make sure that you guys are on the same page. So that kind of lends itself to that type of relationship.
Yeah. So, I mean, as a leader, you're really like closing the loop between, the patients, providers, and adding these technologies. I'm kind of curious what your, what's like the mindset shift? How did you prepare to jump into this role when you knew you were passionate about it?
Honestly, Nick, I can't even explain to you how funny it is when someone asks me, like, how did you think of all these, or how did you create these 3 verticals? I didn't plan on it at all. It's just kind of like the way things happen. You start creating things that are really the main value point is to help the patient, and then everything else just kind of stays there, and things kind of happen. It sort of becomes an idea, and then it becomes like me speaking to different doctors and different specialists and understanding what it is that their pain points are. And I'm constantly saying, oh my God, that's so interesting. Well, I know how to make that better, and I know how to fix that. And I think ultimately I'm like an innovator, right? Like, I feel like I have so many great ideas, and the ultimate purpose is to help people. And so I think that is why everything kind of evolved to where it did, is because I listened to a lot of very intelligent people, very important people in all different sectors of medicine and dentistry. And I'm listening to what their needs are, and I'm being like, I can do this for them. I can help them. And that's kind of how it all comes to play. But it's not like a meditated thought of like writing goals down. I'm going to create this company that's going to be this precision system health, incorporating all verticals of global healthcare, wound care, and diagnostics. Like, that's not what I planned for. I mean, and that's what makes this so incredibly interesting for anyone listening that has an idea. I mean, the pivots are real, and all of these things that you think are happening, it's really just so unpredictable every single day. And you just kind of have to be prepared for, what is working, what isn't working, and really effectively changing the minute you see that there's a better opportunity or a better way to do it.
Yeah. Well, and so I guess without a roadmap there, because I've had a lot of guests on the podcast, and I've talked to a lot of people in the industry that they have ideas. They want to start or launch a product because they have a problem they're trying to solve. Does it have to do with the team that you've built, and like who do you look for while building a team?
I think that's a really great question. First, you kind of like have to know who you are, what your like strengths are, what your weaknesses are. And for me, I knew my weaknesses were in the business world, like how to communicate with people that were not doctors, how to communicate with VC and private equity and, professionals in a different realm of what I was used to. And so I realized that I needed to surround myself with people that had a high financial IQ or high business acumen or organizational skills, operational skills. That really wasn't my forte. And I think I realized that as much as I tried to do everything, I had to give up some of that or relinquish some of that control to the people that knew exactly how to do the thing that I needed them to do. And so, to your point, I picked people that were the opposite personality of me, that had the opposite skill sets of me. And so, because of that, I think I support sort of the whole system and I focus on what I'm really good at. And I put amazing people around me that are the opposite intellectual sort of systems that I have, which is very interesting because you would think that you'd want people like that have your personality, right? But
Yeah.
it's actually not the right thing for the business because it's like a kind of like a orthodontic office, right? You have all these amazing hygienists and assistants working for you. Not each of them are created equal, and every single one of them has an attribute or a skill set that is great. So not everyone needs to be in the back. Some people need to be in the front. Some people need to be working with patients only. And so that's kind of how I took those skill sets as an orthodontist and understanding my office and being able to kind of understand how a business system would be successful by incorporating different personalities at the right space.
Yeah. And the business is focused on mostly B2B sales, right? Is there a reason why you decided to go towards, clinicians rather than and
Yeah, I thought it was very important for me to have the validation of the industry. I remember going to dermatologist's office and they said, this is the one that I trust and this is the one that I believe is great for my patients. And I similarly wanted that type of sort of infiltration into the doctor's practices for them being able to know what OrthoNu was and to say, this is a really incredible product. It has a huge value to all my patients because these are real things that they're going through. And this is the most, incredible kit to have when you start braces or aligners or any type of treatment. And so I started there because the patient acquisition happens at the dental office. Had I put these into CVS or Walmart or even Amazon, I don't know that that would be the right way because I want the patient to feel confident that the orthodontist or the dentist has their back and they're providing them with products that they recommend, that they support. And then I think organically in a couple of years from now, it might become an additional D2C sort of consumer brand. But right now, I really like the way it is from B2B to C. I think it's ultimately the patient that gets it, but it's the knowledge and the education of the doctor that presents it.
yeah, is there a lot of, training in order to adopt the OrthoNu products into, the clinician strategy or?
Yeah, I mean, that definitely was a little bit of a pain point when we first started because, as you know, you get like a plastic bag with a toothbrush and floss and wax, and those are quite inexpensive and really something that is kind of standardized in every office. And so this category of products, as you can imagine, are a bit more high level and a little bit more integrated with science and research and have a lot of different therapeutics. So it warrants itself to be a higher level value add. And so the way we incorporated it is either, as part of the bundle, like which patients really appreciate, right? Because they're going home with everything that they need if there was an emergency within the first couple of days, or it's as a value add being sold in the office, just kind of the way they sell a Sonicare or whitening products or retainers. So that's kind of been the way that it has moved through the industry, but it wasn't easy. It wasn't nothing, by the way, nothing. Every single day is like a battle. Like you have to think of it that way. Like every day you go in and you're like, okay, what do I need to solve today? It's like a chess game. So nothing has been easy, but the truth is the value of the product speaks for themselves and the education piece for the hygienists or the doctors is like nil. They get it, they understand it, and they say, oh my God, where has this been? This is so needed. I think it's more of like the integration into practices and having a whole nother category of products is what has been kind of the building part that we're trying to initiate. And we're building momentum and we have great distributors and great companies working with us to do so. But I think just like anything, a little education for the patient to say, while you're explaining to them that you just got the braces or you just had a treatment done and these are the things that you'll expect, this is how you clean your teeth or this is how you floss. In the same vein, when you have an emergency or when you have a wire poke, this is what you'll use. Or if your son has an ulcer and it's painful when he goes to school, you give them the mouth aid. Or if you're sensitive in your teeth and you can't even put your aligners in, put on the comfort tape. Or if you're feeling like you need to chew on something and you want to chew on pencils, have the OrthoChoose. Those types of like 1 minute conversations that are kind of the typical conversation that a hygienist or a dental assistant would have before the patient leaves the office. That's the education piece to the patient. But the education for any clinician or a hygienist or anyone really, I mean, they see it, they understand.
Yeah. So besides patient care, because you obviously care about the patients, how does that reflected in what success looks like for you? Like what are your goals personally and for OrthoNu, where you like will feel accomplished going through these battles every day?
That's such a great question. And I ask myself that because, there's obviously different levels of success, but ultimately the success is that if we can get as many patients in this world to be able to be having a different dental experience by avoiding and preventing a lot of these painful moments in a child or patient's life, that is success.
Hmm.
I can have, and I have, and this is what keeps me going, is so many testimonials of parents and patients and doctors. This saved me. Having this saved me over the weekend. Or my daughter wasn't going to school because she was in so much pain, but she put on the Chillin Strips and, she was able to eat during school. I mean, like little things like that. That's success right there. Just those one little moments that I was able to help, kind of like what I said in the beginning. If I could help somebody and I can help them even in the most vulnerable moments, even just for a couple of minutes to put a smile on someone's face, that is success.
That's amazing. Well, before we wrap up, where can listeners learn about OrthoNu and follow you in your work?
Well, they can go to my website. We try to put fun stuff on there and blogs and webinars and please email me, or, you can always find out more information, obviously, on the website. But I would love to speak to anyone that's interested. I always love having a great conversation. I think there should be more of those, right?
Yeah.
Now that we've turned to technology and phones, I still think the art of conversation is so beautiful. So happy to speak to anyone or answer any questions. Really excited to get to know people. So that's my thing.
Awesome. Well, thanks for sharing your passion, Dr. Yakoby Epstein. I really appreciate having you on.
Thank you so much, Nick. That was so much fun. Thank you.
Awesome. Until next time.